Going on Offense webinar. My name is Daryl Moon and I'll be your host today. This is the 10th webinar in our new series on workplace mental health and well-being best practices. The sponsor of this series of webinars is a very uniquely proactive mental health and personalized well-being program called Resilience Pro. As we all know, the pandemic has certainly upended the lives of most Americans, and most businesses in this country have been drastically affected as well. These webinars that we have been conducting for the past 7 months have focused on going on offense to address the impact the pandemic is having on the emotional well-being and mental health of individuals. It's exciting to see that there's a vaccination that's going out and that people are starting to get the very first vaccinations. You know, one thing about humans is we don't like uncertainty. We can adjust to a lot of change, and we've done that well, but the uncertainty we've all experienced over the last number of months has been incredibly impactful on overall well-being. So I look forward to the fact that some certainty is now beginning to move into our lives and that there is a vaccine, and it could be months before that vaccine is distributed throughout the entire country, but it certainly creates some level of uncertainty, which I would expect will improve emotional well-being and mental health. Well, today's topic or today's webinar is on ensuring access to quality mental health care. Clearly, the need for mental health care providers has significantly increased with the pandemic. In some areas of the country, it's very difficult to get in to see a mental health provider. Psychiatric hospitals are exploding. Even crisis lines, it's difficult for them to pick up the call on the first ring that they would like to. So instead of having a guest panelist today, I thought I would share a presentation of some of the best practices we've learned over the years. So I'm going to share my screen and show you a presentation. And by the way, as we go through this, feel free to ask questions through your control box, and I'll stop and we can address those questions as we go along. Sorry about that. Did not go to the front of the presentation. Okay, there we go. Sorry about that. So today we're going to talk about ensuring access to quality mental health care. In the outline, they will be on first, what's the highest risk factors out there that cause healthcare costs? What's the problem? What are industry's common practices today? What are the best practices that we've learned? And what are some of the results of those best practices? There's no question, if you look at all the risk factors out there and you say, okay, which one causes the most healthcare claims? Not just mental health care claims, but all healthcare claims. A study done by the Health Enhancement Research Organization many years ago showed that by far, mental health issues like depression and uncontrolled stress tower over almost all other risk factors when it comes to producing medical claims. So it's incredibly important that we address things like depression and uncontrolled stress in a very proactive way if we're going to address not only the mental health care claims, but all healthcare claims. The problem is that people with mental health symptoms often wait on average 10 years before they reach out for help. And 57% of adults with mental illness receive no treatment. So therein lies an incredibly huge black box of problem. People are suffering from mental illness, but not reaching out for help. Now, clearly the pandemic, there's been an increase of the fact that everybody's been struggling. People are more likely or more apt to reach out for help. But still, there are many, because of the stigma, the barrier that gets in the way so often of people reaching out for help for mental health issues is there. And so getting through that barrier and getting people to early intervention is key when it comes to best practices. And we've talked about some of those in prior webinars. So the industry common practices, when it comes to managing mental health, companies purchase a health insurance plan. Often companies will buy an employee assistance program, and they'll let their employees know that it's there. The problem is that with EAPs, across this country, we have a very low utilization rate, which is a significant problem. People aren't getting the help from free, preventative, licensed mental health providers, which is what EAPs offer. And sometimes that's because the EAPs aren't doing a good enough job of promoting them. Sometimes it's because companies aren't doing a good enough job of promoting them. But clearly, it's one of the best resources we have in mental health to get people in early so things don't become greater and wind up causing both additional medical costs as well as more severe mental health care problems. When you go to the EAP, often they have limited number of visits, which is sometimes a problem. And I personally like working with EAPs that have no limits on the number of visits. They're simply limiting the EAP services to those who can respond to solution-focused counseling. People with more severe symptoms will be referred on into treatment, but instead of saying to someone you only get 3 visits or 4 visits, there's unlimited number of visits. It's not a set limit. And so EAPs with limits cause a lot of the problems, because when you get through your first 2 or 3 visits, then you might need to be referred on to a provider through the treatment plan offered by the insurance plan. And often what's offered is simply a list of providers. Here's the list of mental health providers covered by your insurance plan or covered by the network. Well, therein lies one of the greatest problems when it comes to ensuring that people get access to quality mental health care. Why? Because so often, a person looking through a list doesn't know who's going to be a good match for their particular situation. And most importantly, there's a huge provider shortage. In some parts of the country, especially with some mental health specialists, it's almost impossible to get a visit. So a person picks up the phone, starts calling the people on the list. Sorry, we're not taking any new patients. Or if we are, it's months before you'll get an appointment. Many people then fall through the cracks, which is one of the biggest problems we have of ensuring that people get access to good quality care, is that people fall through the cracks and they don't address their issues because getting in to see someone is so difficult and challenging. We're going to talk today about best practices that a team of behavioral health innovators since 1996, which I've had a pleasure to be a part of, envisioned a whole new model of managing population mental health. It was really cutting out some of the middlemen. It was having a more direct relationship between providers and the payers, the employers. It was a system built on taking a capitation risk without any anticipation of increasing the rates, where the focus was on each individual and increasing people's health and early intervention. So the way to make the profit in this particular scenario wasn't to just simply do more services and charge more, but just the opposite. Find ways to get involved early, intervene soon, address issues proactively, so that there are fewer people who actually need treatment. And therein lies the key. As you reduce the number of people who actually need to move into the treatment level of care, there's a lot of options you can put in play to ensure that people can have good access. So we'll talk about some of those strategies. The idea of these innovators was to prove that a new model would work. It's a win-win. Individuals win because they're healthier and happier. Providers win because they earn more profits, and you'll see how that works. And employers win because they have lower costs and more healthy, productive employees. Now, this new model isn't a simple thing. I can't just tell you, oh, just go out and click this one button and it's all going to work. There's clearly a lot that goes into building a whole new model of healthcare, especially when the current healthcare system we have is often more focused on the system than it is on the individual, and really increasing health and well-being of the individual. So the focus on this was to clearly focus on the individual and not the system. So the key of this program is to have lots of level of intervention and do a lot of prevention. If you look at the prevention level of care, it involves both coaches, so success coaches, which health coaches, life coaches, people who can provide behavioral focused coaches, people who can provide a lot of services and an early intervention level to where people don't escalate and then need a licensed mental health professional. But also that prevention level is offering a good EAP or a prevention level of healthcare where there's no copays, people don't have to be diagnosed as mentally ill. And then there are those who do need a higher level of treatment, such as outpatient treatment, specialist provider, medication management, or even sometimes levels of inpatient care. Well, currently, the system that we're most familiar with is that most people get their care in that outpatient or inpatient treatment level, there's very few people that are getting help through that prevention level of care. And that's where the model basically turned things upside down, focusing where most people get all the care they need. 80 to 90% of everybody gets the help they need within the prevention level of care, and very few people really need to move on to that treatment level. And when they do move on, there's a lot of close case management to make sure that people don't fall through the cracks. Let's just take a look at an overall population and look at it from the mental health perspective. If you look at sectors of the population, one of the most important things you can do to prevent mental illness or even other medical conditions is simply build for the company a culture of positive health and positive mental health, a purpose-driven organization that engages their employees in a culture of health and well-being and a positive structure goes a long ways. In fact, some of the very best ROI is simply creating awareness and building a culture of health and well-being within the company. So a model that's going to work best is a model that actually focuses on that and provides support, and it offers, one of the strategies that's been found to be very successful is simply offer everyone a health coach. Health coaches don't cost a lot of money. You can assign a coach to everybody in the population. You can do assessments to identify people early. One of the most effective ways to get people involved early is a well-being tracker. We've talked about that in some of the previous webinars, where instead of waiting for someone to reach out for help, you actually use a pulse survey to monitor people on an ongoing basis to identify who's beginning to struggle. And it's not a mental health tool, and it's not reaching out with a mental health professional. That's part of the problem, is that we often want to hit a nail with a hammer, and sometimes the hammer of a mental health professional is exactly the wrong solution. For people that struggle with that stigma, sometimes the best way to get them involved is to ask them to fill out a well-being survey that only takes a few seconds to fill out. And then when people are beginning to struggle, reach out with compassion through a non-mental health professional, a health coach, where there's not that stigma. That coach can build that relationship and build that trust and actually be an incredibly important catalyst at getting people over that barrier and getting them in to see a therapist, perhaps through that generous employee assistance program. So proactive is clearly one of the most important things you can do in managing population mental health. And then when people do react and want to reach out for help, those 20% that have mental health conditions that are reaching out for help, make sure you've got a generous employee assistance program that offers no limits and really gets a lot of people engaged in that level of care, far more than the traditional. Now, there's going to be people who need more than what a preventive level of EAP can offer. There's going to be those people who need treatment. And so offering treatment through the support of the case manager is incredibly important. That doesn't just mean managing inpatient discharges. If you look at what case managers in most health plans, and even those who specialize in mental health are doing, they're primarily just focusing on the people who wind up in the hospital or in an addiction recovery program. And it's all about how do we help create a discharge plan for the patient that'll be most successful so they don't wind up being readmitted in a few months. Well, that's a component of what a good mental health case manager should do, but there's far more that are incredibly important to managing population mental health. So a good case manager, creating the ideal environment to ensure quality mental health care, is someone who's going to help in that transition from that preventive level of care, that generous EAP, when someone's been seen by the EAP, but they clearly need more treatment. It's not about just giving people the names of 3 providers that are in the network. That's the wrong thing to do. The right thing to do is to have a case manager who's not only there to both enhance the network, but also to coordinate all transitions from that preventive level of care into treatment. And so the approach that we have found to be most successful is to have a case manager that picks up the case when the EAP clinician says, gee, this person needs more help, explains to that case manager, here's the underlying issues that we're seeing. Case manager who knows the network then can identify a provider that's going to be the best fit for that patient, instead of the patient just calling to say, hey, can I get in? Plus they know which providers are taking patients soon. So that case manager coordinates that transition into the provider, making sure that they get an appointment, that appointment is prompt, and that the person actually follows through with the appointment, and then stays involved to follow the patient and make sure that the patient is engaging. one of the problems with mental health is that people can often slip out of treatment, and making sure that that person continues to stay involved is very important. And then that case manager plays an incredibly important role at integrating mental health and medical care providers. One of the greatest savings opportunities that exists out there is to ensure that there's an integration between the medical providers and the mental health providers, which often doesn't happen because of the common silos in the industry. Now, another important role that a case manager plays is to enhance the network of providers. And this is so key in ensuring that people have access to quality mental health providers. That case manager plays an important role at auditing the current network of providers to find out who's got access and who's offering access. If the case manager doesn't know who's not seeing new patients, they might send someone and it doesn't work. And so you've got to make sure that the case manager is keeping on top of the network so that they know who's taking new patients. Now, one of the secrets that we have learned to enhance access to quality mental health professionals is that there is a shortage of mental health providers, and many mental health providers know that. And they know that they don't need to be a part of a network to have a very busy practice. So you contact those high-end quality mental health providers and you say, look, work with us, we'll ensure that your fees you're getting are higher. In fact, that's one of the tricks. Now you say, well, if all you're doing is spending more money on these mental health professionals, how does that help the situation? Well, going back to the original plan, if you have far fewer people who need the help of specialized mental health providers, you can spend more when someone does need that help. So you go to those cash pay only providers and you say, I'll pay you 150% of what you charge on a cash pay basis if you'll simply give us prompt access to your schedule. And so building out a network of enhanced network of providers, sometimes going out to the cash pay providers and offering them more money to get more prompt access is one of the most important things you can do to change the system and make sure that people are getting access to quality mental health providers. Make sure that those providers know you're going to be prompt access to payment. They're going to get their payment very quickly, and there's not going to be a lot of hassles. They don't have to worry about the mental health management company requiring a lot of detailed documentation, a lot of ongoing approvals. And why is that the case? Because you've already taken care of so many people through this prevention level that those people who are low-hanging fruit that you often have to really kind of be worried about, is the provider or the patient taking advantage of the system, they've already been taken care of through this generous employee assistance program. And now you know that these people need care, and you don't need to hassle the provider to say, document everything you're doing and document that they continually need the treatment. So you eliminate the hassles, you pay them more money, but you get prompt access by simply paying them more, and you expand the network, which is often the problem. There's just few providers that will take insurance. You expand that network through a cash pay system and enhance your network, including those people, by offering them more. Other thing that happens when you do this out of the traditional insurance environment way to manage mental health is you can take the handcuffs off. So often it's those handcuffs that an insurance plan puts in place with their network providers or with their providers that creates a lot of the problems. So you can begin to manage to the patient's needs instead of to the benefit design. For example, sometimes some of the best treatment options are remote treatment options. Sometimes treatment in patient's home is the best way to provide care. And the insurance company will often say, well, the only way we'll pay you is that the patient comes to your office. Well, when you move outside of the traditional insurance designs, you can actually do things that make more sense and actually send the therapist to the patient's home. That works incredibly well, especially when you're working with adolescents. Care coordination, non-traditional providers, unconventional support system, case rates, those are all things you can do when you have a case manager that's really managing the patient's situation and they're managing to the patient's needs instead of simply managing to a document or a health plan design. And again, the priority for case managers is the long-term need of the patient. It's been very rewarding over the years to be a part of meetings, case management meetings where we'll be discussing patients and their needs. and to see that the plans that are being designed and developed are far more around what the patient needs instead of what the benefit or the constraints of the benefit plan. And I show you some results that have occurred because of this way of approaching mental health. Here's a case study where an employer over 50,000 members saved $5 million in just mental health claims over a period of 2016 to 2018. That's a $31 million claim savings in terms of total savings. So when you add the medical savings onto the mental health savings, the savings was almost $32 million just in those 2 or 3 years between 2016 and 2018. The ROI, when you consider both the savings on the medical and the mental health, was 7 to 1. $7.75 for every dollar spent. Here's simply a graph that shows mental health savings. Here's a graph showing the actual total savings when you include both the medical and the behavioral health savings. An example of another case study where there were 3,000 employees, where the overall cost for mental health basically stayed flat for a 10-year period of time, because again, this innovative approach. So what we've talked about today is, what are the biggest risk factors? What's the problem? What are some of the common practices used in the industry? And then what have we discovered to be the best practices? And what are some of the results that we've received? So I'd like to open it up to questions now. If you've got a question for me, thank you for participating today. Would love to answer any questions you might have. We'll take those questions now. And you can just use the control box to ask those questions through your panel. Okay, it looks like one of the questions is, okay, this makes sense when you have a very unique out-of-the-box system, but how do you build this in to a current healthcare system with a current design? Actually, the case management is such an incredibly important role. If you simply say, well, we're just going to use the case management that comes with a plan, you're missing out on much of the creativity and innovation. So finding a case manager, bringing that case manager, if we think of the budget that employers spend on healthcare, we often think, well, I'm going to put the whole budget in the traditional health plan design. I'm just going to go buy an insurance plan from an insurance carrier, and all my money is going to go into that one basket. That's where a lot of employers make a big mistake. It's much better to say, here's my overall budget, and this much is going to go into the traditional plan, and I'm going to separate some of that budget to go into some things that are very creative and out of the box that's going to give me an overall less cost. And so one of those things to put your money into is a case manager who can truly expand beyond what a traditional health plan's case manager will do. All right, any other questions? Seeing none, let's go ahead and close things up for today. Thank you for attending. Thank you for your participation. I'd like to just mention that, again, Resilience Pro is the sponsor of these series of webinars, and a brochure describing this solution is available for you to download through your control box. Our next webinar will be on Wednesday, January 6th. We'll be taking a couple weeks off for the holidays, so join us in the new year as we start a whole new series of webinars on how employers can spend their benefit dollars on purchasing aspirational healthcare. The very best healthcare system in the world, by far, is a system called the NUCA system of care in Alaska. Their outcomes are some of the best anywhere, and they spend significantly less than other systems. The healthcare system that they have built is referred to as aspirational healthcare, as opposed to the traditional healthcare across the world, which is more deficit-based. So deficit-based is, let's solve a problem. Aspirational is, let's prevent a problem. Instead of treating a disease, let's avoid a disease in the first place. Instead of just prescribing a treatment plan, how do we inspire change? How does the focus be more on engaging the person in change than just simply making the perfect treatment? I like an analogy that one of the medical directors at the NUCA system uses. Of often in healthcare, it's like throwing a rock at a target. And the more times you throw that rock at that target, the better you're going to be at hitting the target. The problem is that you, the healthcare provider, has all control. And there are a certain amount of healthcare, there's a certain amount of healthcare where the providers are in total control. About 20% of healthcare spend, the providers are in control, but that's a situation like a person shows up for the emergency room, comatose, and they're bleeding. And now the healthcare system has full control. The patient doesn't have any control. It's like, I'm here, just simply fix me. Well, that represents about 20% of healthcare. The other 80% of healthcare is, as this analogy goes, like throwing a live bird at the target. Well, I'm sorry, but that bird's going to fly in whatever direction they want to fly. And so unless we focus on helping that bird reach the target and engaging the patient in their own ownership of their own health and their own change, we're not going to address that other 80% of healthcare, which often is built in chronic conditions. We can prescribe a perfect treatment plan. We can give all kinds of great advice, but unless we actually help engage the person in change and in actually owning their condition and doing the things that they can do, we're not going to reach the maximum opportunities that we have. And NUCA has built a system where it's about not just providing the perfect treatment plan, throwing the rock at the target. It's also about engaging that bird, it's engaging the individual in becoming an owner of their own health and helping them to reach that maximum health and quality. And when you do that, a lot of the healthcare needs go down. So again, that's the difference between aspirational healthcare and deficit-based healthcare. Well, if you want to learn more, my latest Forbes article actually touched on this. The name of the article is How CEOs Can Transfer or Transform Healthcare to Encourage a Healthier Workforce. So if you just simply go to Forbes.com and search Daryl Moon, you'll see that the most recent article I wrote for Forbes was on this idea of the NUCA system of care, aspirational healthcare. So we'll begin a new series coming up in January on aspects of an aspirational healthcare system. So join me on Wednesday, January 6th at 9 o'clock Mountain Standard Time. And as a reminder, all of our recordings of these presentations are being put on the website, goingonoffense.com. And you can check those. We'll be putting this one on later today. There's also a number of other webinars. There's a number of hosts of resources and ideas and suggestions that you can obtain there. So we encourage you to check that out. I'd also like to announce that we'll be organizing and putting on a conference later in 2021. So this summer, July 14th and 15th, this will be a conference highlighting the NUCA system of care. In fact, we'll be putting it on with representatives from the NUCA system of care. They'll be some of the keynote speakers of the conference. Again, it'll be talking about how to move away from just a deficit-based healthcare system, throwing a rock at a target, into a more aspirational healthcare system where the focus is on engaging the person in their most optimal health. So if you would like to learn more about the conference, we'll be putting out more information later as we get closer to that time. But if you'd like to contact us and ask questions specifically about the conference, you can use the Contact Us form on the goingonoffense.com website, and we'll be happy to respond to your questions. Again, that conference will be July 14th and 15th, and we'll be highlighting aspirational healthcare. All right, we'll sign off now and wish you a very wonderful day. Have a good one.